Think of it this way. Blood is driving on a road in the brain and suddenly there's an accident, and that is stroke. But after the accident, for every minute that the person is left untreated, about 2 million nerve cells in the brain die. Depending upon which portion of the brain is injured, different people experience different combinations of disabilities. There could be paralysis of the face, hands or legs, forgetfulness, speech defects, or chewing and swallowing problems. So you see, it affects people and their families, weakening them both physically and mentally. Things that we take for granted, such as the control of food in the mouth, brushing teeth and rinsing water, become difficult for them, and this severely affects their ability to take care of themselves. It is the duty of the dental community to treat these individuals who come for help with the proper care that they deserve, not just the dental community, but the caretakers too. But then, as the saying goes, we always fear what we don't understand. It is this fear that creates a divide between the patient and the dentist, and it is this fear that we hope to kick out the window. Let's say that while taking history, you found out that the person had a stroke just recently. The first thought that should come to your mind is, the risk of another attack is very high for the next 6 months. That is why only urgent dental treatment should be done for the first 6 months after a stroke. But then what is urgent? Anything that increases the chance of another attack of stroke is definitely urgent because it's life-threatening. Aspiration pneumonia is one such condition. It is the infection of the lung which happens when the person breathes the contents of the mouth instead of swallowing. And to add fuel to the fire, the paralysis and the dry mouth that results from stroke greatly increases this risk. So you see, any problem in the mouth, be it tooth decay, periodontitis or oral thrush, can be a reservoir for bacteria or fungi to enter into the lungs. Now let's talk about the problems faced by these individuals due to hospitalization. Firstly, the hospital staff have got a lot on their plate tending to the more pressing health issues. And the nurses know that aspiration pneumonia is a big risk factor. So they are either scared to put anything in the mouth or blame the lack of training in oral care. Secondly, stroke survivors become forgetful sometimes, as mentioned previously. They may brush their teeth in the morning along with taking a shower as part of their daily routine. But at night, they simply forget or feel too weak to brush their teeth. And their experience at the hospital doesn't help either. And finally, imagine a right-handed person brushing teeth with the left hand or even a paralytic right hand on a daily basis in a mouth that has stopped responding properly. The person ends up needing help with putting even the toothpaste on the brush. So these patients wish to get their teeth cleaned but are unable due to the lack of assistance. Now you may be feeling sorry for them, but don't feel too bad for them. Where you feel pity, there is actually a spellbinding ability of the brain called neuroplasticity. What's neuroplasticity, you may ask? It's when the brain adapts, regenerates, and works around the dead cells to construct other neural pathways, when the brain compensates for the damage done by stroke. So there is light at the end of the tunnel, and what doesn't kill only makes you stronger. The one thing that stroke survivors really need, however, is a shoulder to lean on while their body and mind can catch up. Well, that's it for now, folks. Until we meet again.